Alright, so first things first, I'm going to come over, hand hygiene. Better than that, but hand hygiene. Gonna get some gloves on. Not the small gloves, need to find some large ones. Alright, getting some large gloves. Got those on. Alright, so now we're going to come over to the patient, identify their name, date of birth, and allergies. If they have a arm, we're going to check their wrists, compare that with what they say. But if they can't talk, we're going to try to form some way of communication. We're going to ask them, if this is their correct name and date of birth, and they can answer by thumbs up, yes, thumbs down, no. After that, we can also ask if they're in any kind of pain. Thumbs up, yes, thumbs down. All right, next day, we're going to gather our supplies. We got our goggles. We got the mask. We got the sterile water. Got the gloves here, sterile gloves. And we got this neck strap tie thing here. And we got the cannula. This would be in a package, but this is the cannula. And the tracheostomy care kit. After that, we're going to come over, close the curtain. All right, so we already assessed pain, but what we're going to do over here is assess the need for care. On top of that, if they're feeling any pain, offer some kind of pain medication if indicated. Here, you would also like to explain to the patient what you're going to be doing for them here today and explain the purpose of the care. All right, now if the patient is conscious, you're going to place them in a semi-Fowler's position. If the patient is unconscious, place them in an appropriate position based off the assessment of the individual circumstances. Ideally, these side rails would be up, and if they were up, you would place them down, and the ones closest to you are the ones you'd place down. All right, so now you're going to want to raise the bed to a comfortable working height, not lower it how I'm pressing there for some reason. After that, you're going to put on your mask and your goggles. And there go the goggles. All right, so before I start anything else, me personally, I like to put this strap on the back of the neck. All right, so we're going to start doing our sterile field stuff here. Being very cautious, only grabbing the edges right here. All right, looking for the shiny side. We're going shiny side down. Laying away from myself, not touching nothing else. Boom, got that down. All right, so now I'm going to drop the cannula. This would be in a package, so we're going to pretend to open this up. Boop, perfection. All right, so now we're going to get the sterile water here. We're going to make sure we're palming the label. And we're going to lip the sterile water and pour that in here. Perfect. All right, so this left hand over here, I'm going to be stabilizing the plate. It might look like I'm reaching over the sterile field, but I'm not. It's just the angle. Pulling out the cannula in my right hand. We're going to glove that up, throw it away. Do not worry, I did not actually throw this away. All right, so now we're going to don sterile gloves. All right, now the way I set this table up, it's looking beautiful. I'm still facing the sterile field, still facing the patient, not turning my back to him. And I'm warming these gloves up, which helps immensely putting them on. I'm not going to drag you through the whole process, so... Boom, there we go. We got the gloves on. All right, sterile gloves have been donned. There we go. All right, so I'm going to designate my left hand here just to hold the face plate still as I put in the new cannula. Going to hold that still. Put it in a little sideways here. Rotate, go down, make sure it clicks in. All right, so as far as being sterile goes, the only part that needs to be sterile was placing in that new cannula. So no longer have to really worry about that. Next thing I'm doing here is I'm taking out the old pants. All right, so now I'm going to unstrap this one side here. Keeping my hand on the plate. Going to inspect the stoma. All right, so now we're going to go cleaning. We're going to do one wet one here first. Going inside out. One wipe. Going to dispose of that. Keeping my hand on the plate. Using a dry one. There we go. Wiping that away so it's no longer wet. And then we're going to put this strap back on. Over here, I'm struggling to find the one that's the new one. But eventually, we find it and get that strap down. Same exact thing over here on the other side. I'm going to hold the plate down. Going to be cleaning inside out. Got a wet one first. We're keeping the hand on that plate right there. My hand is not touching the cannula coming out of there. I'm just blocking the camera. Keeping hand on the plate. Now we're doing a dry one. All right, looking good. So now I'm going to put one pant leg in over here. Still not touching that cannula. Just being awfully close around it. All right, taking out the old strap. Putting in the new strap here. All right, making sure it's snug, but not too snug. All right, coming around the other side, putting the other pant leg in. And again, making sure it's snug, but not too snug to where we're choking them out. All right, once we get that down, we're going to make sure that we can fit at least 2 fingers behind the strap here. That looks good. All right, so I'm assessing for any pain here. We're going to be lowering their bed back to the safest position. On top of that, we're going to put their guardrail back up and leave the patient with the call light. And that should be good.